A tenth of South Africa's public healthcare facilities have been exempted from relentless rolling blackouts that are currently battling, or rather crippling mainly people, the economy in the country, people's ability to get about and do basic chores even in some instances. The Northwest Health MEC, Madoda Sambatha, is now calling for the province's hospitals to also be added to the list. Let's talk about this with the Deputy Health Minister, Dr. Sibongiseni Dhlomo. Doctor, very good afternoon to you. So, were hospitals in the Northwest deliberately left off that list announced last week?
Good afternoon, Tembele, and good afternoon to your viewers. Not necessarily. You recall that on the 30th of September, the minister led us making a statement, a media statement, where he was saying there's a work in progress that is between the National Department of Health, ESCOM, and municipalities in the country. And on that day, he announced hospitals that are already exempted. You are correct. None of hospitals were exempted in the Northwest as yet. And therefore, that did cause a bit of a concern. It's not only Northwest, Northwest and Northern Cape. So it did bring a concern to the Northwest MEC, and then he approached the department. So can I clearly indicate as of today that we don't have a complete report as yet, but it is an engagement that is continuous between our DG, Dr. Butelezi, with ESCOM and other municipalities in the country. Because sometimes it's the challenge of how to separate a line that is going to be going to the house of Thembekile and that of Dr. Dhlomo, yet we wanted to go to Klerksdorp Hospital, something like that. So it's sometimes in other hospitals not as easy as to exempt without really now affecting or getting every other person around the locality exempted.
However, you would concede, the doctor, wouldn't you, that it does seem weird or odd that only 2 provinces would be affected by those complications, shall we call them?
Tembele, let's this way. In KZN, we has got 11 districts. Only 3 districts actually benefited. It's Pietermaritzburg, is Ladysmith, and Durban. Significant number of hospitals, because maybe that is where there's a referral. So even there may as well be somebody from Nongoma, another person from Mhlabya-Lingana, and everywhere. So let's go to Cape Town again. I mean, Western Cape, we also have benefited Tygerberg, Grootestraat Hospital within the. So even there is the metro of the Western Cape. So,
but Dr. Dhlomo,
yeah.
While I appreciate that example, those are still provinces where there have been exemptions granted, whereas the argument of the Northwest MEC is that none of his hospitals have been afforded this exemption, which then also means that patients in the province as a whole are still disadvantaged compared to people who may even be further from a hospital in the Durban metro, but there's still a hospital that's exempted in their province.
Exactly, Thembekile, because of the discussion. It's not a matter of saying, ESCOM, can you exempt Ridgeway Hospital, for example? It talks to the logistics and the infrastructure of the cablings of ESCOM as to how they can actually be easily divided. So that's what they tell us. It's not a matter of we choose. We, from our side, cannot necessarily disadvantage one province or one district over others. The logistics and the infrastructure of cabling that talks to those issues, like I'm indicating to you, very easy to deal with the metros and probably a bit of a challenge to do with other areas. But it's a work in progress, and we are actually this week learning that ESCOM, Department of Health nationally, are prioritizing Northern Cape and actually Northwest, because they have nothing there as yet to show of the hospitals that actually have been exempted. Yes.
And just to be clear, that's all to do, it's purely because of a cabling challenge.
And probably other logistics that ESCOM brings to the table in discussions. But for us, we actually started by saying, heads of departments, various provinces, can you bring forward what you think we could be prioritizing within your hospitals in your provinces? And all that was submitted to the National Department of Health, DG. Then DG has an engagement with the province, with the ESCOM and municipalities. The issues of logistics, the cabling, ESCOM coming into the picture to say, we can do these ones this week, that week, because it is easy to deal with this, but all the others are work in progress, and we actually understand that you would wish that we have all these that we have submitted to be actually exempted. That is the situation that we have as we speak today.
And when will this work in progress actually be concluded? I know there are more discussions planned for next week, but when will the Northwest know which hospital, if it's just one or two perhaps, that are granted the exemption, will actually be kept connected to the grid 24/7?
The discussion can never be completed because from our side, for as long as there is a load shedding, we will wish that all our facilities that at least are providing a 24-hour service. Look, let me put it this way, Thembekile. Most of our facilities that are providing a 24-hour service do have some resource of generators. What has happened is that our generators have not had a capacity to withstand the absence of electricity for 6 or 8 hours per day. We have been managing when it is 2 hours, and that's fine. The next day, another 2 hours. We have really been fairly managing in all our facilities where we have generators. What has sparked this discussion now is that Eskom, going forward, are you going to have a 2 hour or are you going to have 6 hours? Because in that case, we will then argue that all our facilities that are 24 hours should then be exempted. So it's a work in progress in that regard. But in terms of when are we going to have 2 or 3 in Northwest, it's a discussion that is ongoing, and maybe the DG will be able to forward that to the minister, to myself, latest today afternoon.
So earlier this week, the MEC for Health in the Northwest, Madoda, Sambatha, said that if Eskom does not exempt facilities in that province from load shedding in a week, what's going to happen is there'll be a protest against the power utility, or they'll march to the offices of the utility. Will you dissuade him? Will you discourage him from taking that action?
Look, this was actually a frustration coming in from the MEC because there was actually nothing coming in from us or from Eskom with regards to exemption in his province. So like I'm saying, if we do get a positive response, at least with 2-3 hospitals, there's no reason why we should not communicate that to the MEC as soon as we receive, as soon as they are able to exempt, and therefore the MEC would really, I mean, he was like exempting himself to say, but I've submitted, why am I not being considered? And therefore we are on that space now to say, yes, we have supported the submission of the Northwest, of the Northern Cape. Where are we as Eskom? Please, can you actually update us? So that's a matter that we'll probably be getting responses later this afternoon. As soon as we do that over the weekend, then the MEC might actually be appeased with the progress that we have made. But all of us, we depend on the discussions and the logistics of cabling and what infrastructure Eskom is able to provide us with.
Dr. Sibongiseni Dhlomo, Deputy Minister for Health, thank you for your time today.